Hello juniors, so I welcome you all in the series of general anatomy, and today we are going to cover an important topic which is the synovial joint. So in today's topic we will be covering its introduction, key features, types of synovial joint and its clinical relevance. So without wasting any further time, let's move ahead. So starting with the introduction of topic and starting with the name itself of the topic. So what that synovial joint name actually mean? So in an old age, our old age anatomists, when they dissected a joint, they found a fluid inside the joint, and what they eventually named that fluid is a synovial fluid. And the joint in which they found that fluid, they named that joint as a synovial joint. And you must be knowing joint is a connection between bones. So synovial joint is the most common and most freely movable type of joint in the body. Synovial joints are characterized by joint cavity filled with synovial fluid. As I've already told you, joints are filled with synovial fluid in between. This synovial fluid lubricates the joint and provide nutrition to the cartilage. This cartilage right here is the articular cartilage, and I'll explain in detail in a minute. The joint is surrounded by a tough fibrous capsule that stabilizes the joint. I'll also make you visualize this joint, this fibrous capsule as well. So with the help of this diagram, we will understand the whole anatomy of the synovial joint. So this is the bone number 1. This is the bone number 2. And when the bones are meeting, their ends are covered with the cartilage. Their articular ends are covered with the cartilage, and this cartilage is known as articular cartilage. Right here you can see on top of the bone sits the articular cartilage, and this articular cartilage necessary to reduce the wear and tear loss of bone. So when the bone is making the movements to minimize the wear and tear, the articular cartilage is present. And on the top of the cartilage, if you add something lubricant or a fluid which will further reduce the wear and tear, that fluid is our synovial fluid. So this is the bone right here, which end is covered with articular cartilage. These two are articular cartilage, and in between the articular cartilage lies our synovial fluid. So this synovial fluid is derived from the synovial membrane. As you can see, the cartilage continues as the synovial membrane. Right here, the cartilage continues as synovial membrane, and this synovial membrane is responsible for producing the synovial fluid. And at the outermost of the joint lies our tough fibrous capsule, which is protective in nature and stabilizes the joint. This is the articular capsule, tough fibrous capsule. So this is the coronal view of a joint, and this is an oblique view. You would be better able to appreciate this. This one is a bone number 1, bone number 2. The bones, the end of the bones are covered with the white color cartilage. This is the cartilage, and the cartilage itself continues as synovial membrane. This synovial membrane is responsible for producing the synovial fluid. This synovial fluid, articular cartilage, both are responsible for decreasing the wear and tear in between the bones, and the tough fibrous outer layer, which is the articular capsule, is responsible for stabilizing the joint. Now to understand the importance of this articular cartilage and synovial fluid, if you take two pieces of chalk and rub against each other or grind them face to face, you will see a white dusty powder. So that would be the consequence of bone if the articular cartilage and synovial membrane were absent. The bones would rub against each other while performing the movement, and the wear and tear would be so much that the bones would not be able to maintain their shape and eventually would be grinded up with the friction. So now coming to the key features of the joint, as we have discussed above. First, the joint cavity. A space between the bones is filled with synovial fluid, as I have already told you. This is the space between the bones which is filled all together with the synovial fluid. This was our joint cavity. Synovial fluid. Synovial fluid is a viscous fluid that lubricates the joint and nourishes the cartilage. And this synovial fluid, as I've already told you, is derived from synovial membrane. Thirdly, the articular cartilage. This a smooth, slippery tissue that covers the end of the bones and reduces friction. As I've already told you above, if there were no articular cartilage present, the bones would eventually grind it up and will lose their shape due to friction. Joint capsule. The joint capsule is a tough fibrous capsule that surrounds the joint and helps to stabilize the joint. So this is the joint capsule, white colored capsule which stabilizes the joint. This was our joint cavity filled with synovial fluid. The white color cartilage was our articular cartilage. The articular cartilage is named so because it is lying over the surface of articulating bones. So basically, if these two were the bone number 1 and the bone number 2, and if these were the surfaces that were going to come in contact with each other, so these surfaces are called as articular surfaces that are going to articulate with each other. And if at top of the surface I add a cartilage, this is the cartilage, then I would name this cartilage as articular cartilage. Hope you are able to understand this. Rest, I have the ligaments. Ligaments connect bone to bone, as you all must be knowing. You must have studied this in your NEET examination preparation. Tendons connect the muscle to bones. You all must be knowing this. Now coming to the types of synovial joint. So there are various types of synovial joints and we'll be covering them one by one. So our first type of joint is hinge joint. Hinge joint allows the movement in one plane. So you all can correlate with the door hinges, which only allow the movement of the door in one plane. It does not allow upward, downward or any other movement. So example of this joint is the knee joint and elbow joint. So this is the hinge. You can see if this was a rotatory part, it can only go from this direction to this direction. That means only one plane of movement is allowed for this joint. So this is the elbow joint. You can appreciate that we can move our elbow in only one direction, in only one plane. The second type of synovial joint is our pivot joint. So pivot joint allow rotation around a single axis, and the example of this joint is atlantoaxial joint. Atlantoaxial joint is a joint between first and second vertebrae of neck, which allows the head to move back and forth. So this is the kind of pivot joint. It allows the movement of bone on its axis. So bone can rotate around the single axis like I have shown here. So the greatest example of this pivot kind of joint is atlantoaxial joint. When a professor is taking a class and you hear some notorious backbenchers making stuff at the back, so what do? You turn your head backwards and wanted to see the atmosphere of the back and then crave for joining them. So turning back of the head is facilitated by the pivot joint. That is, it allows the head to move back and forth. Or simply you can say in back and in front. So our third joint is the saddle joint. It allows movement in two planes. Example, carpometacarpal joint. So carpometacarpal joint of thumb. So this is the saddle type of joint. It allows movement in two planes. If this was the rotatory part, it could move here in front and in back. And if this was the rotatory part, it could move either right here or to the left. So it allows movement in two planes. The best example for this joint is carpometacarpal joint of the thumb. You can see this is the thumb joint right here. It can go here as well and there, and also in the opposite direction in the another plane. Coming to the fourth type of synovial joint, which is the condyloid joint. So this is the joint which allow movement in two axes. Example, wrist and toes joint. So right here is the wrist joint. You can see with the help of this animation that firstly it is moving in this and this direction, and then it is going anteriorly and posteriorly. So these are the two axes of movement for the joint. Coming to the ball and socket type of joint, this joint allow movement in multiple planes. Example, the hip and shoulder joint. So as you all know, your hip and shoulder joint are freely movable. There's a vast majority of axis of movement you can achieve on hip joint and shoulder joint as well. Coming to the last kind of joint, which is the gliding joint, also known as plane joint. This is a joint between two flat bones and allow for limited gliding movement. And the example for the gliding joint is acromioclavicular joint. So this is the acromion process of scapula and this is the clavicle. And the articular surfaces of both the bones are flat. So this kind of joint is between the two flat bones. So with the help of this you must be able to understand this, that this is the one part of the scapula, the acromion process, and another is the part of the clavicle. These both are the flat bones, and the connection and the joint in between them is the gliding joint, and it allows for limited gliding movement. You can only achieve a limited amount of movement in this kind of joint. So up till now we have done 6 types of synovial joint, and you don't need to memorize them. You can practical them in real life on yourself or on your partner, but you don't need to memorize them. Once you will start to visualize and make the concepts clear, anatomy will be a piece of cake for you. So I will never suggest you to memorize the anatomy. So for now, I'll give you a mnemonic for each of the joint we have covered till now, so that you won't miss any joint in your examination. And the way I used to remember the initials of all the joints is, so this is my hinge joint, my condylar joint, my pivot joint, saddle type of joint, gliding joint, and ball and socket type of joint. And the way I used to remember this mnemonic was Himachal to Chandigarh to Punjab to South Delhi and finally to the GB road. So those who are not knowing, these are the cities and states in the country of India, and this is a special landmark in the capital of India, which is Delhi. So this was the way I used to remember all kinds of joints with this mnemonic. If you found this mnemonic helpful, you can use it, or if you have something else which suits you, you can use that as well. So now rubbing all this. And now you must be wondering why sir is wasting his time and why sir is wasting your time as well teaching this simple topic like joint, and why to deeply go through this topic as everybody has the joints, and why so much efforts on this small topic. So my dear students, this is necessary to have a great knowledge of the joints, because in your whole doctor career you will face a numerous number of patients with the problem in their joints. So you need to have a thorough understanding, thorough knowledge of the anatomy and physiology of the joints. So with this, we comes to the clinical relevance of our today's topic. So studying synovial joints is clinically relevant because they are the most common types of joints in the human body, and therefore understanding their structure and function is critical for diagnosing and treating joints pain, inflammation, and condition like arthritis. So this is the healthy joint. We have studied the anatomy of synovial joint. This is the state of the joint and condition like osteoarthritis, and this is the state of the joint and condition like rheumatoid arthritis. And if you opt for ortho branch in your post graduation, you will encounter a numerous number of bone fractures related to the joints. And finally, the synovial fluid and synovial membrane, which we have studied right now, are the key indicators of disease pathology, as in osteoarthritis and rheumatoid arthritis. So completed with the topic of synovial joints, completed its introduction, key features, types of synovial joint, and its clinical relevance. If you found this video helpful, do like it, do share it with your friends. Thank you.